the idea for this lunch session was to be able to have a chance to showcase some lives of activism. Some of the papers that were presented focused on biographical approaches to the study of the AFSC's past, and we wanted a chance to highlight those. So, but because it is lunch and more informal, we're doing away with the moderator, commentator, discussant model and just introducing ourselves and talking. So I'm Tracy Kmeyer. I am a professor of history at the University of Louisville. I am also the co-director of something called the Oral History Center. And I've been here doing research in the AFSC archives since, I'm so sad to say this, 2008, on a book that I'm still just finishing writing. So yeah, I've been around for a while. And one of the things that, what I'm going to talk about today is oral history. And I sort of, with a little bit of tongue-in-cheek, named my paper, Mom, What Did You Do in the Struggle for Peace and Justice? Using Oral History to Document the Work of the AFSC. And when I say paper, that's an exaggeration. It's not really a formal paper. It's more of a talk about what we know, what we don't know, and what we should know using oral history. So just to start off, let me just say that oral history is the process of audio recording people's memories about their own experience of the past for the purpose of documenting the past. Oral history requires an interviewer and an interviewee, someone who speaks about their own experience, and then the interview is donated to an archive or public library where it can be used by scholars. And so what I want to start off by talking about is what we have here already in the AFSC archives or in other places what oral histories already exist and how they document and what they teach us about the organization. So the AFSC archives has a number of collections that have been done over the years. The earliest ones were done in the late 1980s with men who were in the World War I Reconstruction work. So the very first work of the organization, they're fascinating interviews. All the men were in their 90s when they were interviewed. So they talk about their own experience growing up in Quaker communities, why they joined the first Haverford unit to go over to Europe during the war, and what their experiences there were. Personally, I was so excited to discover that collection because it's the longest ago interviews I've ever read. In other words, the subject that happened the longest ago documented by oral history that I had ever personally read. So I was all squealy when I found those interviews. There's also a collection on the work camps, the 1930s and 40s early work camps, and some of the people who went to work in various service projects around the country as part of that. Closest to my own research, which is on housing, there is a collection on the Friends Self-Help Housing Cooperative that was founded here in just a few blocks away, actually. Was a effort to use self-help housing techniques to build an integrated community in the heart of the slum area of Philadelphia. It still exists, although is now an independent, still cooperative, but now independent of the AFSC organization. There are interviews about the Japanese American relocation program. This is an interesting project because it includes interviews both with the men and women from the organization who worked to try to find ways to help young Japanese Americans move out of the internment centers and into jobs or educational experiences in the eastern part of the United States. And it also includes interviews with those young men and women who were helped to move. So you get kind of a lot of very rich material about life in the internment camps before the young people were able to move away. There's another collection which is on in the 1970s, the Nationwide Women's Program and the Third World Coalition and how those organizations were formed within the AFSC. And there's, speaking of the work this morning from the last panel, there's interviews with people who worked with Palestinians in the Gaza Strip between 1948 and 1951. And in the same series, a collection of interviews with people who did relief work in Mexico and El Salvador, also in the 1950s. So that's kind of what's here in the archives already. Those are collections that have been transcribed, archived, and are able to be used. I've learned this week that Don tells me there's a number of other interviews that are more recent acquisitions that have not yet really been fully processed. A brand new collection that he just handed me this week on interviews with the Southeast Regional Office in North Carolina. About 13 interviews that were done in 2016 with longtime people in that office documenting the work of that region. One of the things that is important to know is there are oral history interviews with the AFSC staff and volunteers that exist in other libraries around the country. These were often done for other purposes, for other projects, but then the people happen to talk about their AFSC work. For example, at the University of North Carolina of Greensboro, there is a Greensboro Civil Rights Oral History Project, which includes several members of the Southeast Regional Office talking about school desegregation work that the organization did there. At the Holocaust Museum in DC, includes interviews with German refugees that the AFSC had helped to move out of the country. I think, I'm sure Susan knows about this collection. The Luther Seminary includes an interview with Margaret Stanley, who of course was with the medical team who went to China in the late 1940s. The University of North Carolina, Chapel Hill, my alma mater, includes interviews with people who were textile workers who were helped by AFSC staff members who came there during textile strikes. So kind of an interesting contrast, even just 10 years later from some of the stuff that Guy was talking about this morning. 10 years later, when they are invited into North Carolina strike situation, they are less squeamish, I guess you could say, maybe about more overtly siding with the workers' side of that story. And the interview is with 3 of the strike leaders talking about that relationship. There's also a collection at Berkeley, which is about friends in the Berkeley area, but many of those who were interviewed were also members of the AFSC. So you can find these interviews around the country. There's also interviews here. What I thought I'd talk about a little bit is some of the things that we learned from the interviews, what's in these interviews, and then a little bit at the end about what's not, right? One of the things, because every good oral history interview starts with background information about this person speaking, so you get a lot of great biographical information, people's stories about their families experiences with migration, with war, with economic deprivation, sort of the background stories that people come from that shape their involvement. Especially in the earlier projects, the projects that cover the earlier periods, you get a lot of information about growing up in Friends culture, people talking about the Friends schools that they attended, Friends meetings that they attended, the different Friends organizations, youth organizations in particular, that they participated in. And so you do get this very interesting snapshot of sort of 19-teens, 20s, 30s Friends youth culture. And how it influences young people in their later lives. One part of that, not quite Friends culture, but so closely related, is what's very obvious is how important for men the experience in the civilian public service was. When you talk to the people who went to Gaza, who went to El Salvador, who went to Mexico, many, if not most, of the men who were being interviewed were in the CPS camps during World War II. And so that connection becomes really clear. One of the things to keep in mind is that in almost all of these projects, not all the people interviewed are Friends. Many of them are from other Protestant denominations. There are a lot of Methodists, a lot of Presbyterians who come into the work through interest and service. Some of them previously connected to the Y or to their own church youth organizations. In some cases, coming out of work with the New Deal. but you know, they had different faith background. They worked with the New Deal and then went into the AFSC work, in particular in the work camps. I would say even certainly at least half the people interviewed in the work camp project were not friends. So it brings in that idea of, one, how early that experience is of the AFSC bringing in non-friends who shared the values, but also for a historian, it's a nice, again, it's a window into a world of sort of interdenominational faith-based service in that early 20th century, mid-20th century time period. One of the interesting, I've done a couple interviews since I've been here, and this has come up a couple times. One of my insights that I did not expect from the interviews, but keeps coming up, is, I'm not sure how to put this gently, but the extent to which the AFSC is also a job, right? And talking about it as a job, and why that's appealing in terms of people who are looking to do good, looking to do service, looking to express their beliefs, but also have children and a spouse who have to be provided for and have to be taken care of. And so you get a lot of interesting perspective on how the job of being in the AFSC interacts with family life, especially for those who part of the job is travel and for moving about and for going away. And how does that impact family life? One of my personal favorite stories is an interview that's not yet in the collection, because I did it not that long ago, but it will be in the collection, is with one of the, a man named Bernard Lafayette, who was hired by the AFSC away from King and SCLC, who were trying to keep him, but the AFSC wanted him, hired him, and he went back and forth, yes. Dr. Mantler knows all about Bernard Lafayette and the SCLC, but he had worked with sit-ins and freedom rides and all that stuff. In 1964, he's hired by the AFSC. King tries to recruit him away. Come work for us in Selma, come work for us in Poor People's Campaign, which you'll hear about in a few minutes later today. And Lafayette basically has a baby. He needs the health insurance. And he says to King, yeah, AFSC is a movement job with benefits. King could not match that, so AFSC got to keep Bernard Lafayette. Although they lent him quite often. They lent Lafayette to King and other social movement work the whole time he worked for them. So you get this interesting view of what it's like to actually work as a job and how that impacts your family. And one of the things that came up in the previous panel questions that, and even in the first panel, there was a lot of questions about how how working for the organization impacts people as individuals. And we saw that wonderful story in Dr. Aiken's, I can say doctor now, right? Dr. Aiken's paper this morning with Luella, right? Yeah, Luella Jones, and how clearly that affected her. Well, you see a lot of that in the oral histories as well, how people are affected as individuals by the difficulty of the work in some situations, but also by the experience of being in a small village in Mexico. The Mexico Project in particular has a lot of really rich material about the social aspect of being in a different culture and how that affects people, both the friendships they formed and the sort of social life aspect, birthday parties and those kinds of celebrations, and then how it affects them in what they choose to do later in their lives. So some of that question that was raised about how this affects people, oral history helps us to get that. You also get a lot of, kind of related to that, a lot of the day-to-day experiences in these projects. One of the things in my own work I'm interested in, and it kind of goes even to Dr. Lakey's talk this morning, is how do people keep going, right? This is very difficult work. This is long-term work, as Dr. Johnson kept saying in his paper about South Carolina. This is long-term work. It's difficult work. There's a lot of obstacles. Sometimes you can't really see the fruition of your work on a day-to-day basis. How do you keep going? And so people really, yeah, I got it. I'm way ahead of myself anyway. So people keep going. They talk about those resources, right? The last thing I'll say before I talk about what we want to do next is the other thing that comes across is self-criticism. You know, if you look at a lot of organizations' papers, you get the annual reports, you get the fundraising appeals, you get the board, you know, the requests to some foundation, and it's sometimes a little glowing, right, in terms of how great everything's going and all that kind of stuff. What's interesting to me in the interviews is how willing people are to be self-critical. What we did that didn't work, what we did that was wrong. In the Mexico project, there's one woman tells a whole story about how they introduced DDT to the agricultural work in this community and her long-running sense of guilt about this. There's some of the people going to work in Palestine saying, you know, they gave us a number of books to read on the history and the problems of oil in the Middle East, but we talked to people who had been in various service committee projects and no one had talked about, quote, Arab culture. And we had to learn it on our own. So there's a willingness to sort of see the difficulties, see the obstacles, see what went wrong that comes across in a situation in an oral history interview where people years later have the opportunity to reflect. So there's a lot of interesting things in the interviews. I want to say 2 more sentences, what's not and what we want to do about it. Even if you listen to the list of interviews, you might notice a chronological problem in that there's a lot of interviews that go up to about the mid-1970s. And then there's nothing. There's no interviews that really cover material that the AFSC did since about the mid-1970s. There's a surprising, for me, lack of discussion of faith and belief, but that's, you know, has to do with what questions people choose to ask. But one of the things that we're trying to do, and taking advantage of this gathering, is to sort of promote the idea of doing more oral histories on the more recent periods, you know, getting the story of the 80s, 90s, and now 2000s documented for future generations. I've done a couple interviews in the last couple days, interviewed Stephen McNeil, who sat up here just a little while ago, as a man, Jason Tower, who's sitting back there in the back. So we're starting to do some, but this is mostly a plea for people to be willing, if someone contacts you and says, we would like to do some interviews in your area, to consider sharing your story as that opportunity arises. I'll be around all day. I'll be around this evening at the alumni gathering, hopefully gathering some names of either people you think should be interviewed or if you'd be willing to be interviewed yourself. So I'll just put that little plug in and sure, yeah. We're trying, so yeah, so we're trying, and so far, frankly, the interviews I'm doing are in places where I have some place I can stay for free. So, you know, Chicago, Berkeley, DC, Philadelphia, you know, places I can stay for free. One possibility would be interesting to look into seeing if regional offices would be willing to be trained to have people do interviews in them, you know, or connect with oral history people who are in those regions. So, for example, this project on the Southeast region came from an oral historian at UNCG, right? And there's projects like that. I mean, there's oral historians all over the country. So I'm open to any ideas people have in terms of doing that. But on my own dime, I have to go where I can go for free, basically. So, one last question?
I find it fascinating what you're up to, and thank you for doing it. I do oral history. I'm all excited.
I know. I
every
want to
time
talk to you
hear
about
a story.
it. Yeah.
Are you doing your home office here?
Well, I'm not here. I'm in Louisville, Kentucky.
Oh,
so,
okay. But is somebody doing this office? Because I can think of people locally.
This week, we were hoping to get more people lined up than we were able to. Just because people were so busy this week. This was like a bad week to try and interview people, as it turns out. So I was only able to get 4 interviews this week because of people's schedules. But yes, we do hope to be able to continue this. My idea was I would do this or help other people do it over about the next year, right?
How do I point you and name names for you? Do I send you an email?
Yes. And Don has my email, so yeah. We're going to turn it over now.
I'm Vanessa Northington Gamble, and I'm a university professor of Medical Humanities at George Washington University, where I'm also Professor of American Studies and also Professor of Health Policy. And what I'm going to be talking today is from a biography that I'm writing on Dr. Virginia Alexander. In September 1930, the Race Relations Committee of the Philadelphia Yearly Meeting named Virginia Alexander its first black member. Since she was not a friend, she had to be joined as an unofficial member representing her race. Previously, the committee had excluded African Americans because some members believed that they could speak more freely and with greater disinterest as a solely white committee than as a mixed group. Alexander's sincere and abiding friendships with several Quakers had led to her pioneering appointment. At her very first meeting, she gave notice that she would use her new position to urge the group to take action against hospital discrimination. Virginia Alexander's work on the Race Relations Committee influenced her decision to become a Quaker. In February 1931, 5 months after her appointment, she became a member of the Society of Friends, and for several years, she was the only African-American Quaker in Philadelphia. One of the few black women physicians in the city, Alexander lived a life that combined professional accomplishment with passionate social activism and a deep commitment to Quakerism. This afternoon, I will present a brief overview of Dr. Alexander's life and examine how she led an activist life dedicated to social justice, medicine, and religion. Virginia Alexander was born on February 4th, 1899, in South Philadelphia, and had a hard-scrabble childhood. She became motherless when she was 4, and her father lost his previously successful writing academy when she was 13. After her mother's death, her struggling father sent Virginia and her 4 siblings to live with their aunt and uncle in North Philadelphia. In 1917, Virginia graduated with honors from high school and received an academic scholarship to the University of Pennsylvania. She blazed through her undergraduate studies and obtained a bachelor's degree in education. When she entered the Women's Medical College of Pennsylvania in September 1920, there were only 65 black women practicing medicine in the United States, 5 of them in Philadelphia. During medical school, Virginia encountered several racist incidents, but persisted and graduated in 1925. When she sought an internship, both racism and sexism hampered her search. The director of Philadelphia General Hospital informed her that she would not be appointed even if she were first in 1,000 applicants. There goes the meritocracy. The hospital operated by her own school was not even an option because it did not accept black interns. School officials did help her and a classmate secure positions at Kansas City Colored Hospital, where they became the first women interns. After her internship, Virginia remained in Kansas City for another year to do a pediatric residency. Brimming with optimism about her professional prospects, Virginia returned to Philadelphia in 1927 to open up her own practice and to improve the health of her North Philadelphia neighborhood. 3 years later, she established the Esperanto Health Home, a 3-bed private hospital in North Philadelphia. She viewed the facility as a refuge from the racism then pervasive in Philadelphia hospitals. Although organized medicine opposed such arrangements, she wanted her health home to eventually become a socialized practice. That is, a group practice with shared responsibilities that emphasize service to the community. Virginia's medical practice blossomed. She maintained a large but by no means lucrative practice. At a time when nationwide a rigid colored line in medicine existed, Alexander's practice was unique. She saw black and white patients and was one of the few African Americans to obtain a hospital appointment beyond Philadelphia's 2 black hospitals. Many of Virginia's white patients were Quakers. She had initially established ties with friends, while as a freshman at Penn, she went to worship at a Quaker meeting house. From that very first encounter, Virginia discovered spiritual connectedness and found that Quakerism suited her religious temperament. She later recalled that she had experienced an overwhelming sense of satisfaction and was convinced that this was worship at its best. Upon her return from Kansas City, social, political, and spiritual factors led Virginia to deepen her ties to the Society of Friends. A strong proponent of interracialism, she believed that interracial dialogue and contact were effective tools to combat racial prejudice. As a member of the Race Relations Committee that I mentioned in the introduction, Alexander forcibly pushed it to address racial discrimination in the city's hospitals. She persuaded it to help her get one of her patients admitted to Friends Hospital, a Quaker-operated mental institution. In early 1931, the patient, a fair-skinned schoolteacher, had been admitted and then ejected from another mental hospital after it was discovered that she was Black. Subsequently, she was rejected by Friends Hospital, again because of her race. The Race Relations Committee failed in its efforts to get her admitted. Its efforts in desegregating the medical staff at the city-operated Philadelphia General Hospital were more productive, and in 1936, the facility appointed its first Black doctor. Alexander had indeed succeeded in getting the committee to tackle the problem of racial discrimination in medical care. As one member observed, largely because her firm but reconciling approach, hospital doors were open that had been shut. In December 1930, 2 months after Alexander joined the Race Relations Committee, she applied for membership to Germantown Monthly Meeting. Although a few overseers feared future complications, including an increase in Black membership, the admission of Black children into their school, and the possibility of interracial marriage, the monthly meeting approved her application in February 1931. Virginia enthusiastically embraced her new religion and became an active member. She participated in the activities of the Young Friends movement, and in 1933 began a 2-year stint on its executive committee. Alexander also served as a delegate to the 1937 Friends World Conference, an international gathering of Quakers. She was one of the few Black attendees and the only one named to a racial justice commission. The following year, she became a member of the social industrial section of the AFSC. Alexander guided the direction of the 3rd Annual Institute of Race Relations held in July 1935 under the auspices of the AFSC and the Race Relations Committee of the Philadelphia Yearly Meeting. A major goal of this interracial seminar was the study of scientific methods to analyze and solve racial problems. Alexander conceived, co-directed, and solicited funding for a research project conducted by Institute students on the social, economic, and health problems of North Philadelphia. Her work on this project underscores the scope of her activist life to promote racial justice in medical care. Dr. Alexander's final report painted a bleak picture of the health of Black Philadelphians. For example, in 1926, Black infants died almost twice as often as white ones. I have to say that that is still true today, that Black babies still die twice as much, and in some places it's 3 times as much. So this is 1926. And in 1927, African Americans died from tuberculosis at about 6 times the rate of whites. Alexander attributed these sobering statistics primarily to social and political factors. Her report graphically documented medical discrimination in Philadelphia. Many hospitals maintained separate accommodations for Black patients or refused to admit them. The study also described the racism that Black people sought when they sought treatment. One woman recounted her experience to Alexander as such: "I had trouble getting my child into the hospital because the hospital had no isolation ward. Resident doctor called my child accountable because she didn't stop chewing gum the minute he asked her to stop. Another described her fears about entering one of the city's hospitals. I was told to go to Hahnemann for an operation, but I was afraid to go because they always tell you that you need an operation when you don't, and then you can't have any more babies. The report also detailed the obstacles that African American nurses and physicians face. Most of the city's hospitals barred them. Of the 50 black doctors in North Philadelphia, only 5, including Alexander, had hospital privileges outside of the city's 2 black hospitals. As Alexander herself knew firsthand, when black physicians were fortunate enough to receive privileges at white hospitals, they often encountered hostilities. In one instance, she went to a clinic to inquire about a patient. The intern who answered the door assumed that she was a patient and chastised her for coming after hours. Dr. Alexander was shocked by the discourteous, reproachful attack that she received from this intern, who she said did not know her from any other colored woman. She added, when I thanked her and said, "I am Dr. Alexander," and turned away. I think I taught a lesson in race relations. She recalled that at another hospital, most of the staff seemed unable to rise to the situation of having ordinary civil or professional relations with a colored doctor. White nurses and even elevator operators treated her disrespectfully. Alexander's report recommended the creation of an interracial public health center in North Philadelphia to provide medical care and health education, to offer training for black physicians and nurses, to serve as a model for the integration of medical facilities, and to promote interracial understanding. The center was not built, but Alexander successfully used the report's findings to lobby whites, including members of the Friends Race Relations Committee and the AFSC, to take active roles in battling medical racism. Alexander's work on the project also strengthened her conviction that the health of African Americans depended not just on medical care, but also on broader societal factors. In 1936, a year after the study's completion, she became the first black student admitted to the Yale School of Public Health. The following year, she began what she called her voluntary exile from her beloved Philadelphia. It lasted 9 years. During this period, Virginia worked in student and public health at Howard University in Washington, and also practiced maternal and child health in Birmingham, Alabama. All the while, she maintained enduring ties to her hometown. She continued her membership at Germantown Monthly Meeting and returned to worship there as often as possible. When she married William Childs, a Roman Catholic, in Birmingham in June 1945, she sought and received her meeting's approval. But the main draw of Philadelphia was family, especially her 2 nieces, Mary Elizabeth and Ray Pace, who she absolutely adored. Virginia wanted Mary Elizabeth to become a Quaker and occasionally took her to Sunday school at Germantown Monthly Meeting. In 1938, she sought to have the 3-year-old admitted to Germantown Friends School. The school committee, however, rejected the application. It concluded the time has not yet come for the natural, happy, and helpful admission of Negro children to our school. The rejection devastated Virginia. She descended into such profound grief that 11 days after learning the school committee's decision, she wrote her funeral wishes on the back of an envelope. She wanted a Quaker-style memorial, but not in a meeting house. Virginia later admitted that this painful episode of her niece's rejection had caused her to lose her zest for her meeting, but not for her religion. She declared, "The substance of my faith is very, very real to me, and try if I would, I could not overcome the influence of Quakerism." When Alexander returned to Philadelphia in 1945, she once again became a member of the Race Relations Committee of the yearly meeting. She also worked as a medical examiner for the AFSC, and in that capacity, examined staff members and overseas workers. But perhaps influenced by the new post-war black radicalism, she had begun to express doubts about Quaker methods to advance racial equality. In July 1944, Virginia traveled to the highly regarded Mayo Clinic in Rochester, Minnesota, for clinical evaluation of lupus, a disease she had suffered from for 7 years. She was frequently plagued by its acute and chronic manifestations. The disease led to several hospitalizations, including one during which she was so critically ill that her family feared that she would die. While in Rochester, she wrote her sister-in-law on Independence Day about the racism that she had encountered in the town. Hotels barred her, and restaurants refused to serve her. She also discussed her impatience with the continuing plight of Black Americans and the limitations of Quaker methods to address the problem. She wrote, "I am thinking of a new technique for handling such racially discriminatory situations, and it's not a Quakerly way, nor one that I could adopt. But it seems to me that others of us who become unwilling to go the slower way of conference, arbitration, and power of the ballot methods may have to resort to an underground sabotage method that will make discriminating classes feel the immediate cost of hatred and discriminatory measures. North, South, East, and West, we are having a rotten experience." Despite growing doubts, racial discrimination, and personal disappointments, Virginia Alexander remained an active and activist Quaker until her death. Continued commitment to the Society of Friends and the AFSC allowed Alexander to integrate 3 convictions important to her, namely religion, medicine, and racial justice. Quakerism suited her religious temperament and provided her with a sense of spiritual fulfillment. She contended that its silent meditations offered her spiritual renewal and perfection in prayer. A fellow Quaker once remarked on how quickly Virginia would settle into a mood of deep worship when she arrived to meeting. Virginia's political philosophy of interracialism also influenced her religious and activist choices. Quaker organizations were one of the few interracial groups that attempted to address racial injustice, and she frequently used her personal narrative to spur these groups into action. She bore witness to the humiliation and pain that she suffered as a Black woman physician as a way to influence the racial attitudes of white Americans. In February 1949, the AFSC Race Relations Committee held a conference on medical discrimination at which Virginia Alexander poignantly spoke about her humiliation and that of her patients within the healthcare system. A meeting participant observed, "Friends who knew the depth and quality of her life felt a deep sense of gratitude for her quiet, simple, yet effective testimony." Virginia Alexander died on July 24, 1949, from lupus complications. Among the hundreds of condolences that her family received was one from AFSC Executive Director Clarence Pickett, who eulogized her as an example of the spirit of true service. A month before her death, Alexander attended her last meeting of the Race Relations Committee of the Philadelphia Yearly Meeting. Almost 20 years after she had first brought the issue before the committee, the agenda included a discussion about continuing efforts to fight hospital discrimination, a fitting legacy to her influence. Dr. Virginia M. Alexander used her religious ties as a springboard for her activism. Her life story vividly expands our understanding of past efforts to combat racial injustice in medicine. In addition, her biography makes plain the nature, dimensions, and struggles of unshakable faith and unrelenting activism and what it has meant to be a Black Quaker activist. Thank you very much.